Today, we are covering one of the most important micronutrient groups in human health, your fat-soluble vitamins. These are vitamins A, D, E, and K. They are called fat-soluble because they absorb together with dietary fat stored in the body, especially in the liver and fatty tissues. This makes them different from water-soluble vitamins. Water-soluble vitamins are generally excreted more easily, but fat-soluble can accumulate over time. There's two important things. Deficiency can develop very slowly, but excessive intake can become toxic. Today we'll cover what they are, the role of each vitamin, best dietary sources, deficiency states, toxicity risks, and practical clinical takeaways. So, what are they? What are fat-soluble vitamins? Like we said, they are vitamins that require normal digestion and absorption of fat. They depend on adequate dietary intake of fat, appropriate bioproduction from the gallbladder, as well as appropriate pancreatic enzyme function and healthy intestinal absorption. People with fat malabsorption conditions can become deficient, such as celiac disease, pancreatitis, cholestatic liver disease, bariatric surgery, certain types of inflammatory bowel diseases. This slide is just it's just a summary of the key little features. So vitamin A. Vitamin A, also called retinol, is found in animal foods, animal sources, and carotenoids, which are found in plant sources, typically colorful plants. Major functions include vision, especially night vision, eye surface health, immune function, skin and epithelial integrity, as well as good growth and development. In vitamin A deficiency, patients can develop night blindness, dry eyes, lowered immunity, and dry skin. Some good dietary sources for vitamin A include liver, egg yolks, dairy, carrots for your beta carotene. It's in the name. Sweet potato, spinach. Um, Excess supplementation of vitamin A can be toxic, and this is especially dangerous in pregnancy because it is teratogenic in high doses. Vitamin D. Vitamin D behaves more like a hormone than a classic vitamin, can be produced in the skin through sunlight exposure. The main functions of vitamin D are calcium absorption, bone mineralization, muscle strength, immune modulation. Deficiency is quite common worldwide, and your risk factors for things like rickets, muscle weakness, osteomalacia, and osteopenia are an indoor lifestyle, darker skin pigmentation, excessive sunscreen use, obesity, and aging. So, what are some good dietary sources? Sunlight, that's your primary one. Um, Either sort of midday and late afternoon sun is very important for vitamin D, especially in a way to prevent um, a risk of getting sunburnt from high noon sun exposure. Fatty fish like salmon and sardines, important. Egg yolks, very important as well. And nowadays, many cereals are also fortified with vitamin D. Now, like we said, fat soluble vitamins can be toxic. So, excess vitamin D can cause hypercalcemia because the vitamin D helps the absorption of calcium. Too much vitamin D means you absorb too much calcium. Calcium, especially, is important for heart muscle function. It can give you kidney stones, mostly because of the, again, calcium absorption, as well as confusion, nausea, and vomiting. Vitamin E is one of the body's major fat phase antioxidants. Key roles of this normally include protecting cell membranes from oxidative damage, supporting immune health, and protecting lipids from oxidation. Deficiency is uncommon in healthy individuals, but it can occur in severe fat malabsorption. Um, Typical deficiency signs are neuropathy, muscle weakness, and even hemolysis. Hemolysis is the breakdown of blood products into waste products. Dietary sources of vitamin E, some good ones: almonds, sunflower seeds, avo, and olive oil. Um, Important to note, high dose supplementation can increase your bleeding risk in certain patients, especially when combined with things like warfarin or rivaroxaban, even aspirin. Um, Vitamin K comes in two main forms: K1, called phyloquinone, which is from plants, especially leafy greens, and then K2, which is menaquinone, from animal sources or your fermented foods. Um, Most supplements are going to have vitamin K2. Major functions of this include activating your clotting factors, supporting proteins for bone production, such as osteocalcin, and then it regulates the deposition of calcium into your bones. Deficiency can cause easy bruising, bleeding tendencies, or coagulopathies, and newborns especially are at risk of vitamin K deficiency. Hence, they tend to get injections at birth. Sources of vitamin K include kale and spinach, your leafy greens, broccoli, fermented foods such as natto. If you've ever had natto, you'll know it's an acquired taste. Let me just put it like that. Um, some cheeses and eggs are also important. Vitamin K, important, can reverse or interfere with the effects of anticoagulants. So if someone comes in with warfarin toxicity, vitamin K is a targeted therapy to help activate their clotting cascade again. So most of these vitamin deficiencies are not caused by bad luck. They often reflect one of four main problems, that being poor intake, poor absorption, increased requirement, or chronic disease. For example, low vitamin D can reflect low sunlight. Low vitamin K can reflect recent antibiotic use, poor diet, or malabsorption. Low vitamin A may reflect poor intake or chronic GI disease, so always think relative to the patient. So what are the nutritional recommendations? Rather than obsessing over food supplements, start with food quality. A practical weekly pattern includes dairy, fortified alternatives, eggs, fatty fish, leafy greens, orange vegetables, nuts and seeds, and some healthy fats with meals. This improves both intake and absorption. If you want to know more about fats, watch the Fats Explained lecture. So what are our take-home here messages? Our fat-soluble vitamins are A, D, E, and K, ADEC. They need fat to be absorbed and stored. Vitamin D deficiency is the most common of all of these. Malabsorption disorders, celiac, Crohn's, IBS, increase the risk of all of these deficiencies. Food-first approaches are usually best, and more supplementation is not always better because toxicity risk is especially high in fat-soluble vitamins. So, in conclusion, fat-soluble vitamins are small molecules with major influence. They affect vision, bones, immunity, clotting, and long-term health. If you understand them well, you understand a key part of preventative medicine. Thank you for watching.